I never thought I'd be holding, or that we would be holding a hearing under these sad circumstances, but I think it's a necessary one. Our country is in pain. Americans are afraid, they're sick, they're hungry, and jobless, and over 80,000 souls have been lost. And the government that was supposed to protect them has failed. There are heroes, and they have risen. Extraordinary, ordinary Americans showing courage, compassion, and a sense of self-sacrifice and duty beyond what could have or should have been asked of them. Regular Americans have risen when their leaders have not. We are the greatest country on earth, and yet we have the most cases and the most deaths from COVID-19 of any nation in the world. Why? First is the inept, ineffective, and extremely late effort to respond to what was clear to many scientists and public health experts in January. That basic delay cost precious lives and is continuing to cost lives. We can't have a system where the price paid is unconscionable. Mothers losing daughters, daughters losing fathers because of incompetence, denial, delay, and a disorganized response. Frankly, I'm tired of those who bear the responsibility accepting none of it while deflecting blame on others. The previous administration, the World Health Organization, the Wuhan lab, anywhere but where the blame belongs. Second, the United States has and remains dangerously dependent on foreign countries for our supply of critical life-saving drugs and life-saving equipment, masks, gloves, PPE, and ventilators. As a result, we can't treat our own people without relying on China and others to supply us. We can't outfit our first responders, our hospital workers, our nurses, our doctors. We can't care for our own nation in crisis. This surely is a national security issue. I want to thank the gentlewoman from Indiana, Ms. Brooks, for her bipartisan work with me to address the drug supply chain issue, as well as other members on a bipartisan basis for their legislation on those issues as well. Today, we're going to hear about the disastrous federal response to an approaching pandemic. Dr. Bright has filed one of the most specific and troubling whistleblower complaints I've ever seen. He was the right person with the right judgment at the right time. He was not only ignored, he was fired for being right. We can't have a system where the government fires those who get it right and reward those who get it completely wrong. Mr. Michael Bowen, the Executive Vice President of Prestige Meritech, will speak to America's crippling dependence on foreign countries for critical medical supplies, a public health issue and a national security issue. Our country is paying a terrible price today, and it rests on Congress to address this threat where any effort of an adversary can cut off our supply of life-saving drugs and supplies, our lifeline. And this would create a healthcare disaster on a scale never experienced before. I bear this responsibility, as does every member of Congress. This subcommittee has jurisdiction over our country's most prestigious healthcare institutions, FDA, NIH, CDC, and BARDA. We have to listen, we have to learn, and we must work together for the people of our country who need us so, so much, regardless of inconvenient truths. Finally, I regret that Secretary Azar, Dr. Robert Kadlec, and Dr. Peter Navarro have all refused to testify today. I now ask for for a moment of silence in honor of the over 80,000 Americans who have lost their lives from COVID-19.